welcome to Nutrition Moment. Here we talk about what we eat and how it impacts our health. I am Fadila Okunum. Let's start as usual with recent events and developments in the field of nutrition on Nutri News. You are welcome back. According to the Diabetes Association of Nigeria, about 11 million people are grappling with diabetes. Why is diabetes considered a chronic disease? What are the health implications of diabetes and what measures should be taken to improve the health and well-being of people living with diabetes, especially through nutrition? On NutriLens today, our focus is all about diabetes. Join me.
According to the World Health Organization, over 400 million people worldwide have diabetes. Diabetes is considered a chronic disease characterized by high level of blood glucose or sugar, which over the time results in the damage of vital body organs such as the heart, kidney, eyes, blood vessels, and the nerves.
Diabetes is actually a chronic metabolic disorder that results from an elevated sugar. Being diabetic can be of two parts. There's the type 1 diabetes and there's type 2. Type 1 is when people are insulin dependent, meaning that they don't have any form of insulin in their body. While the type 2 is people that, okay, yes, they've not been insulin dependent, but as time goes by, as they age, they now develop diabetes, which can be because of the lifestyle they've been living and an healthy lifestyle. Diabetes is actually an hereditary disease. So for the young people, yes, like I said, the type 1, it mostly happens to children. Even some children are born diabetic. So that's type 1 diabetic. In the past, from age 40 is when we say people might have the tendency of having diabetes. But now, even people that are 20 years old, 25, 30 are becoming diabetic. So it's just good to check and ascertain what is your status. It's not a reversible or curable disease, but it can only be managed. So the earlier you detect it, you are able to handle and take care of it.
As diabetes is labeled a serious medical condition, health experts call attention to the warning signs of the disease and emphasize the need for people to undertake regular checkups to monitor their glucose or blood sugar levels.
It's a chronic metabolic disorder and it affects all the organs of the body. So it's good to catch it young, like when it is just getting noticed. And there are few symptoms one can notice when somebody is diabetic, meaning that the person can have excess weight gain or at the same time have a drastic weight loss. At the same time, too, people can have excessive frequency of urinating. That means that in the middle of the night, they go to urinate frequently. Then excessive thirst as well, when you feel thirsty as much as possible. Another predisposing factor for diabetes is obesity. You find out that when people are overweight or obese, yes, they can either predispose them to having diabetes. So that's why I would advise that people should do their health check regularly. Do your sugar tests as often as possible to know what the value is, because there's a gap in between being diabetic and not being diabetic that we call pre-diabetes. So when you check your sugar level, checking once does not determine that you are diabetic. So we say, okay, go further to do some certain tests. One of the other tests you can do is called the oral glucose test, whereby you check your fasting blood sugar, then they give you a certain amount of glucose to consume. Then 1 hour after you have consumed it, your sugar is checked, which your glucose level is checked. 2 hours after as well, the glucose is checked. That 2 hours mark after taking the glucose, it gives a time for the body to be able to use up the glucose that has been ingested. Then also, we can go further also to check the HbA1c. Helps to check what the glucose in the blood has been in the last 3 months. So you are able to know, okay, what has been my glucose level, the range that it has been in the last 3 months. Because you find out that when even people want to come to the hospital for follow-up, they know I'm going to see my doctor next week. They start being cautious of what they are eating and they try to abide. So when you check their fasting blood sugar is normal, it's okay. But when we now ask them to go further and check their HbA1c, we realize that your blood sugar has not been well managed. So it gives a true sense of what the sugar has been in the last 3 months.
With a large majority of people living with the disease in Nigeria, there are a lot of misconceptions about the cause of the disease and its management, especially when it comes to sugar intake. A survey was carried out to assess people's understanding of diabetes. To clear up the misconception between diabetes and sugar, nutritionists say sugar intake does not lead to diabetes but can elevate the sugar level of those already predisposed to the disease.
It's not about the amount of sugar that you take that determines if you are diabetic or not. There is something in the body that we call insulin. So when we eat and the food that we have eaten has broken down into glucose, the insulin is released into the body to allow the glucose to be passed in through the cells and to the required organs that need it at that point in time. But when the insulin that is produced, either it is not enough or it's not even produced at all, then the sugar in the blood, which is called the glucose, is raised. It becomes elevated. So it's not about, if you take sugar or you take fizzy drinks, does not determine you being diabetic or not. But if you are, they are added things that when you take them, it can increase your sugar level. But taking sugar does not necessarily say that you become diabetic, because all the people I do check for to determine their glucose level, they tell me, I take a lot of sugar, but my sugar is fine. I tell them, yes, your body is able to use up the glucose that you have taken, the soft drinks or the fizzy drinks that you have taken, your body is able to use it up.
On a positive note, health experts say diabetes can be managed with the right diet, physical activity, medication, and regular screening and treatment for complications.
Nutrition is actually one of the key roles in management of diabetes. Is one of these, even the major role in treatment of diabetes, meaning that when you have a right nutrition, you can ensure that you can manage your diabetes appropriately. There's something we call glycemic index of food, meaning that for all food groups, when you consume a certain amount of food, the rate at which your blood glucose rises is different. For glucose, is 100%. That's why we use that as our test mark for the oral glucose test. The next is honey. Honey is about 82%. So some people that say, oh, I'm diabetic, but I can take honey. No, honey and glucose are still almost in the same family because they will still raise the glucose level. But we consider honey to be a natural source, but it is still, if you're staying off sugar, it's also best to stay off honey. Then also there are some other food sources that contain high amount of fiber are actually best for people that are diabetic because it helps them to eat and get filled up easily. So it's not about the quantity of the food that you have to eat that matters here. The portion control works with diabetes people. Eating lots of fruit and vegetables that has high fiber is good. Then you saying that you don't want to take any form of carbohydrates would not necessarily help with managing diabetes. Yes, you still have to take your carbohydrate, but in a required portion. And also, there are some certain factors. The age is very important. The sex of the person is very important. The physical activity of the individual is also very important in determining what to eat and what not to eat. For diabetic patients, we tell them that there's nothing they should stay off, but just that you know your body best and you should know what works for your body. So like I said, there are certain foods that when you eat them, it raises your sugar level. So you can do your own personal elimination. When you take some certain food and you check your sugar level and you notice that this particular food makes my sugar level go up, it's best to eliminate it or remove it from your meal and find a better substitute. For yam, some people take yam and they say, oh, it raises my glucose level. While some other people will take the same yam and they'll say it doesn't raise their glucose level. So the yam that you're consuming, like I said, physical activity is very, very important. Then the quantity. Somebody that takes 4 slices of yam and the person that takes 2 slices of yam, the rate at which their sugar level will go up is different. It's best to eat moderate amount of food. Yes, you want to fill your body with nutrients, but not too much. The body requires just a little of these nutrients that we're consuming. So it's not the quantity of the food that will give you the required nutrients, but how quality the food is, not the quantity. Foods that contains fiber, they fill you easily. So by the time you're taking foods that contain fiber, the quantity you're eating won't be much. So you get filled up and it's less of calorie that you get from it. So it's more healthy because you're eating, it's not like you're starving. You're eating, but you're ensuring that you're getting filled up easily with fiber and other nutrients.
14th of November is World Diabetes Day. Established in 1991 by the International Diabetes Federation with support from World Health Organization to raise awareness about the disease that affects 1 in 10 adults worldwide.
I hope that was enlightening to you. Remember, check your blood sugar level regularly to stay healthy. Follow us on our YouTube channel, subscribe, like, share, and don't forget to hit the notification button for more. Join me next week for more insights into what we eat. Bye for now.